It's a multifunctional system that combines targeted abdominal nerve block injections with the most advanced port closure device. Slide the button to rotate the T-bar and insert directly through the trocar. This makes it easy to find a port path in obese patients or with really angled ports. The T-bar automatically flips open and rests directly against the peritoneum. Press the plunger to the first click, which advances 2 needles simultaneously, but they do not go all the way down, they stop a precise distance deep inside abdominal wall. Now, you can inject local into the top holes of M-close, which then spreads inside the plane surrounding the port site. Take a look, you can see the nice bulging you get with a spread around the port. If you use local with epinephrine, it infiltrates the exact suture path, not only relieving pain but helps reduce bleeding. Next, press completely down on the plunger. The needles now penetrate the fascia simultaneously. Most importantly, there are never any exposed needles. Here is a 43 BMI patient. Look at the bowel right near the defect. This closure would be very difficult with a free needle, especially if you are losing pneumo. This case would be very difficult without M-close. Next, insert the included guide wire into the top of the plunger and then pass any suture of your choice through the loop in the wire. Pull the wire out completely, which brings the suture out the other end. The T-bar is then straightened out and M-close is removed, leaving behind a perfectly symmetrical suture deep inside the port. With M-close, the suture loop is always the same size even in very obese patients. Suture passers capture a lot more tissue, which leads to pain. Also, you can see suture bites are very consistent. You don't get a big bite on one side and a small on the other. M-close is the only port closure device with 2 opposing needles that penetrate both edges of the defect simultaneously 180 degrees across from each other. Here is an actual training video for the Carter Thomason. Look at the tenting, then look how close it comes to hitting the bowel. They end up missing the defect completely and have to place a second suture. But it's easy to miss, since even a small deviation from one needle to the other can lead to the suture missing most of the defect. Bleeding is also an issue, as suture passer needles are significantly larger than M-close needles. M-close needles never deviate further than 1 centimeter from edge of defect and, more importantly, only go in once. Suture passers go in and out trying to find the right location, which causes more tissue trauma and lead to bleeding. A study on M-close showed significant reduction in hematomas after surgery. Hematomas are not benign, as they can lead to infection. Another very important benefit is that M-close needles come from the bottom of device. So even if it's a large patient or a thin patient, the suture loop is always at the bottom. Other devices come from the top, and, in obese patients, you end up capturing a lot of tissue and fat, which can lead to pain and dimpling. Also, M-close can close even the largest defects by quickly delivering multiple sutures. You can turn it 90 degrees or you can go apex to apex. Best of all, M-close kit is cost-effective and priced in the $80 price range, which actually is less costly than other port closure devices, yet provides the added benefits of a nerve block system. Don't wait, contact us today to try our revolutionary device for free.